Good evening, everyone, and welcome to our Facebook Live Town Hall. This evening, our topic is healthcare policy, healthcare reform, and our current COVID crisis. So I really appreciate you all joining us. I am Dr. Hiral. I am the Democratic nominee here in Arizona 6, running against David Schweikert, and I'm really so excited about tonight's conversation. We have a wonderful special guest that will be joining us in just a moment, Dr. Quinn Snyder, and I'm looking forward to a really thoughtful, valuable conversation about healthcare policy and the current crisis that we're facing. I want to mention that if anybody has any questions at any point during this, that you're supposed to be texting your question to the number that'll be on the screen. We want to make sure we get everybody's questions answered. So please do make sure to do that so we have a great, engaging conversation. For those folks that I've not met before, I'd like to tell you a little bit about my background and why healthcare is so important to me personally. I'm a former emergency medicine physician. So my background is medicine, practiced clinically for many years, for over a decade. And I also spent many years in cancer research advocacy, bringing other researchers and funding organizations. And specifically, my entire professional life has been focused on healthcare. It's been focused on solving complex problems and trying to deliver real implementable solutions that make a positive impact in people's lives. And I honestly think that those skills will translate very well to Congress because we need more problem solvers. We need more folks who are focused on that positive impact in people's lives and less on partisanship. Um, Healthcare is the reason I decided to run, which should be no big to you. It was sort of a confluence of things, though. Number one, the experiences I had as a ER physician, having had the opportunity to care for thousands of families, and many of those that were struggling because they did not have access to our healthcare system. Parents who brought in their child far too late in their illness because they didn't have access to a primary care doctor. Folks with chronic illnesses that didn't have regular care to maintain their illness, and so they came in with complications and exacerbations. People who were rationing their medication because they couldn't afford their prescription drugs. All of those are side effects and collateral damage of our healthcare system not covering everybody. So that, along with what happened in November of 2016, when the big threat was that after that election, the GOP would go ahead with their threat of repeal and replace, but that was really just repeal because there's been no plan for replace. That the idea that 20 million people would lose their health care, to me, that was unconscionable. And that's when I decided I had to run. And healthcare still remains at the top of everybody's conversation, certainly in our district, in our state, and in our nation. So with that being said, I am very excited to introduce our special guest this evening, Dr. Quinn Snyder. And there he is. Hi,
Hello,
Quinn.
good
How are
evening,
you?
Hiral. Great.
Good to
Thanks
see
for
you.
having me.
Absolutely. It's great to have you here. And I was just thinking about, Quinn, I want you to introduce yourself in just a minute, but I was thinking about the first time you and I met. And again, it was about healthcare, right? It was after the 2016 election, and you were rounding up folks leading a healthcare rally. Really, it was about the same concern that we're going to talk about tonight, the idea that the ACA would be repealed and millions of Americans would be left without healthcare, without access to the healthcare system, without affordable healthcare, without having the ability to take care of their families and themselves. That's how we first met, was at a healthcare rally. And here we are, I guess it's now 4 years later, and we're still having the same conversation. So I wish it was under better terms, but I am so glad to have you joining me tonight. Would you go ahead and just introduce yourself and tell folks a little bit about your background?
Sure. Thanks a lot, Hiral. So I'm Quinn Snyder, and I'm an emergency physician. I've been practicing for over 10 years now in the Phoenix metro area. My family moved here in 1994, and I've been back and forth here in Arizona since that time. But I've been a true Phoenician for the past 10 years. And I have a wife and two kids, and I truly love what I do, practicing emergency medicine. And I've also been a healthcare advocate alongside you for many years. And yes, I remember very clearly being at that rally where we had 150 healthcare professionals outside of John McCain's office, where we were all advocating for healthcare together. It felt like a special moment. And, maybe, just maybe, that helped give John McCain some of the courage to give that big thumbs down that really altered the landscape of American healthcare. So I really appreciate you then and throughout all these years for all the work you've done. Thank you, Hiral.
Absolutely. And I think that's, you have been an incredible healthcare advocate. In addition to your clinical duties, you have been out there remaining on the front line, making sure you advocate not just for healthcare coverage and for better patient care, but also on behalf of healthcare workers, which we're going to talk about in a little bit, about how, this pandemic has affected our frontline workers and where government missteps have seriously impeded the ability for healthcare workers to do their job safely and free of additional risk of exposure. So thank you again for joining. And yes, I would like to think that what we were able to do in raising those collective voices, eventually led to Senator McCain's very historic thumbs down. That's really that. I mean, if it were not for that moment, right, Quinn, this, we would be in a very different state already. That would have been the end of the ACA right there and then. So Senator McCain will always have an incredible legacy in addition for everything else, certainly for that moment. Um, so I'd like to talk a little bit about, why it's so important that we protect the ACA. I think it's interesting because the ACA has never been popular than it is now, right? We know that. And I remember when the ACA was being proposed, this Affordable Care Act was being proposed by President Obama, and it was felt that it was incredibly unpopular. And I think it was because a lot of folks didn't understand exactly all the provisions that would come through this ACA that would really directly impact people's lives. And now that people have had this for over 6 years, the idea that there's a risk of all those provisions and protections being repealed is incredibly worrisome. So I want to talk a little bit, Quinn, about the ACA and why we need to really fight on behalf of protecting it. And what I always kind of compare this to, right, as ER physicians, we're always taught the ABCs, right? Airway, breathing, circulation. Make sure you address those most urgent issues first. Otherwise, everything else is it's not going to change. It's not going to matter. The way I look at the ACA issue is that we have to stop the bleeding now, which means stopping this perpetual erosion that this current administration has been conducting on the ACA, right? From day one, it's been everything that they've done to sabotage the efficacy of the ACA, to sabotage the security of the marketplace, to sabotage the ability to maintain low costs and continue those cost sharing reduction payments, to limit access to new enrollees, in times of the enrollment period. Just all of those things that they have done that has really sabotaged the ACA. And now there's obviously, as you know, a full-blown attempt that is being conducted to repeal it. For those folks who may not know, 1 week after this election, on November 10th of this year, the ACA case that is being brought up by this administration, as well as aided by multiple attorneys general across the country, is going in front of the Supreme Court on November 10th. And that is basically an argument that they're making, that they believe that the entire ACA should be repealed. And I'm going to say this a few times tonight. We're talking about 23 million Americans who will lose their health care. And this includes 1 out of every 2 Americans, because that's about the incidence of pre-existing conditions. People will lose protections for pre-existing conditions. That is beyond unconscionable to me. I know it is to you. Before we talk about some of the other aspects of the ACA, I'd love to hear your thoughts on the idea that that case is going in front of SCOTUS on November 10th.
I mean, to me, to think that in the middle of a pandemic, in perhaps the biggest public health care crisis in 100 years, we're talking about taking healthcare away from people is unconscionable is definitely the word. It's so impossible to even consider that is the direction that one of our political parties is headed, where they're trying to literally strip healthcare away from people in their greatest time of need. And whereas the other political party, the Democrats, are trying to get healthcare to more people. They're advancing towards universal healthcare. And this election, there's no doubt that healthcare is on the ballot in this election, and that we're talking about a big fork in the road. We're talking about stripping healthcare away from people who are in their greatest time of need, or are we trying to get more people the healthcare that they desperately need as soon as possible? So to me, it's so hard to even consider that there are people out there, that there are these forces out there in the world that are still trying to take healthcare away from Americans, when it's obvious that the vast majority of people want to get more healthcare for more people and to keep people safe. If there's anything we've learned in this pandemic, it's that if you don't have adequate healthcare coverage, if you don't have a good healthcare apparatus, it can often lead to dramatically worse outcomes. And you can see what's happened with COVID, and it's just been an absolute catastrophe. Were we in a position where we had more people with adequate healthcare coverage, with real healthcare coverage, there would be no doubt that tens of thousands of people would probably
Mhm.
have not suffered some of these ill effects, and would not have potentially even died from the coronavirus.
Right. Yeah, no, absolutely. And I mean, you touched on a little bit, and I'd like to talk about this a little bit more later on, but about the disparities, right? The disparities in outcomes when we talk about certain communities that have been more harshly impacted by this virus for multiple reasons, right? It's not about just about exposure to the virus, it's about underlying disparities that make them more vulnerable to the effects of the virus, more prone to be in settings where they're, not able to protect themselves, not able to socially distance. And they tend to be those, some of those frontline or essential workers. And then on top of it, they may not have access to healthcare. They may have pre-existing conditions that make them more vulnerable. It's just, the list of factors goes on and on. And the point you raise is absolutely critical. Is at the core of this issue. Is that so much of the loss of life, the pain and suffering, the economic consequences, so much of that was preventable. And we know that. That is not just, you and I talking. That is proven by public health experts and epidemiologists from all across this country and the world. And just to put a real light on this, right now, as of today, our country has 7.3 million cases of coronavirus, or people that have tested positive for it, and 207,000 Americans have died. I mean, over 200,000 Americans have died from this. And we're talking about in what, 7 months. Here in Arizona alone, 19,000 cases, and 5,674 of our fellow Arizonans have died, almost 6,000. So it's heartbreaking to think of what it could have been had we had different leadership. But I'd like to go back to talk about the ACA, about some of the other provisions just briefly, because I think, again, a lot of folks don't know all the benefits of the ACA, right? Because it's been sort of vilified in some ways by bankers. One of the parts, obviously, that we hear about all the time is the pre-existing condition coverage, but other parts we don't hear about is the ban on any kind of lifetime caps on benefits, the fact that kids can stay on their parents' plans till they're 26, the fact that there can be no junk plans, right? That plans have to have those provisional healthcare benefits. Things, visiting the emergency department, getting mental health services, being able to cover prescription drug prices, prenatal care for pregnant moms, and postpartum care. All of these things that are, of course, should be covered in health. As you know, and I know, there have been a lot of junk plans that don't actually cover anybody. All they do is put money in the pockets of insurance companies. But these are some of those really critical pieces of the ACA that I hope all Americans really understand, that how this has transformed healthcare coverage, insurance, and our ability to pay. I'm sure that's come up with patients in the emergency department that you've seen, I imagine.
Yeah, absolutely. People are very concerned about their access to healthcare and where things are going in the future. And by the way, I'm glad you touched on those junk plans, because that's really when you're hearing from many Republican candidates when they're talking about trying to expand healthcare and they want to create affordable options. A lot of that is actually code for creating available junk plans. And what junk plans are is underinsurance. It's not real insurance. It's not something that normal people can afford. And there are many uninsured people out there right now. And if things head the wrong direction in this election, there will only be more either uninsured or underinsured people with not real health care. That's not actually taking care of patients. And as physicians, our goal is to make sure that we do whatever we can to take care of our patients. And it's really heartbreaking when we have people come in who have been denying their acute or chronic illness for a very long time simply because they couldn't afford going to the doctor. It's not fair to them. They shouldn't have to suffer that way. And boy, and during the time of COVID, that has been really magnified. We've seen so many people who've been delaying their care in terms of getting appropriate medical care for just basic conditions, or surgical care even was being prevented in many cases, being prolonged and extended in ways that frankly were totally unacceptable, especially in July where things were overflowing. But this is absolutely a big concern to all of our patients out there. They're very concerned about what's going to happen in this election and with their ability to access insurance in the future. It's on the ballot.
Yeah, absolutely. Well put. Um, so I wanted to, remind people that, when we talk about health insurance, right? I mean, a lot of times it's all about cost. That's all we hear is the financial cost. And then you hear people talk about, well, I don't want to have to pay for your health care. Like that's what they think, that somehow they're being burdened, right? Um, I don't know how many times I've said this, but we're already paying for everybody's health care, right? We are already paying for that because we have millions of Americans, as you mentioned, that are either under or uninsured, and they are still receiving care, right? Because as we know, as ER physicians, EMTALA laws require us to see and care for everybody that walks through that department. And obviously, there are medical emergencies and surgical emergencies and very appropriate cases that should come absolutely through the emergency department. But there are a lot of times that we see patients, and I know you see this still on a regular basis. We see patients that aren't there for an emergency, but they're there simply because they don't have any other access to the healthcare system. And I was wondering if you'd like to touch base a little bit on that, of some of the cases, or just some of the stories that you may have seen about people that literally um, stayed home far too long, or just did not have access to the healthcare system. And sometimes, right, Quinn, it's also those social determinants of health that bring them to the emergency department. It could be homelessness. It could be the issues of mental health or addiction, or being victims of domestic abuse or violence. All of those other things that ultimately land somebody in the emergency department, and then we are there to care for them. So just thought maybe if you could share maybe a story or two, or recalling a patient or two that you've seen that highlights how important it is that we actually have comprehensive care for every American.
Yeah, when you mentioned that about a patient that stayed at home too long, that should have gotten healthcare sooner, it made me recall a patient I had not too long ago, that came in because he was having chest pain for a week, and he decided to stay at home knowing he didn't have health insurance, and he was hoping that it would just merely go away. And what happened was, after a few days, he started to feel more short of breath. And then he started to develop fluid in his legs. And he couldn't even get his shoes on anymore. And then finally, after a full week, he decided to come in. And when this gentleman came in, it was obvious that he had been having a heart attack for the last week. And the thing about a heart attack, one of the things that's really dangerous about a heart attack is that the heart muscle itself will begin to die off. And all of a sudden, you're not able to adequately pump the blood through your heart. And when you're not able to do that, you can develop something called congestive heart failure, where fluid can build up in your lungs and you become short of breath, or it can build up in your extremities and you're unable to even walk sometimes because your legs are so heavy. And this poor gentleman, he was only 50 years old, and he told me that he had not seen a physician in over a year, and he had a history of high blood pressure. All he had to do was take a medication that literally cost $4, $4 a month. And instead of taking this simple medication and then not getting his acute care either, he ended up in a situation where he was going to be facing a very short life ahead, and one that was full of a lot of suffering and disability, frankly, where he would never lead a normal life again. I mean, the solutions here to have fixed this would have been so simple had he had insurance and access to adequate health care. And it's an absolute shame that this happens to people all the time. We see it all the time in the emergency department. And you're right, the emergency department is a refuge for people who don't have access to primary care. And the truth is, we're happy to take care of them. Of course, we take care of them. But it's not the best place for somebody to be taken care of as a primary care in a primary care setting. There's a good chance I won't see these people more than once in the emergency department. You know, how am I supposed to develop a relationship with these people over time? That's what a primary care doctor does. They understand their patients, they know how to best direct their care over the long term. So it just shows just how critical it is for people to have health insurance in the long term, to be able to develop those relationships with their primary care doctors, to get better outcomes, and to do it for pennies on the dollar. Whereas the amount of healthcare spending that occurred in the last several months, if not years, of this gentleman's life were so much greater than that $4 a month prescription that he could have had for his high blood pressure. It's a terrible tragedy, and it shouldn't be like this. We don't have to live in an environment like this. We need better leadership.
Yeah, absolutely. And it's heartbreaking, right? When you think of how many um, times that kind of scenario plays itself out, that that you experienced with that patient of yours. Um, I want to share just briefly a quick story of a woman I saw in the emergency department several years back, and she came in the ER. So 4 months prior to coming to the emergency department, she had felt a lump in her breast. She did not have health care insurance. She didn't have health insurance. She didn't have a primary care provider. She worked an hourly wage job, had no benefits. And so she wasn't able to see a doctor, get a mammogram, anything like that. She stayed home for, several months with that lump. And when she finally showed up in the emergency department, she came in because she had an oozing sore on her chest wall. And what that was, and I'm sure her cancer had become so aggressive, it had literally eaten through her sternum, eaten through her breastbone, and she had this wound on her skin, and that it was because of the obvious nature of this that she couldn't avoid anymore. That she finally came into the emergency department. At this point, needless to say, her body was riddled with tumor, and she passed away several weeks later. And to think that this was a woman in her early 40s, if she had had the care that she needed at the time she needed it, she could have absolutely had a full cure, and she could have gone on to live, many, many years of a good, healthy life. And that woman's life matters, right? Just like your 50-plus-year-old gentleman's patient, his life matters. And there's no reason that their life should matter less because of our broken healthcare system, because of an insurance card. We can do better in this country, and we have to do better. And I think, if anything, this pandemic has shown a light on the fact that healthcare and our economy and just the survival of our communities, it's all so inextricably linked, right? You can't talk about one issue without talking about the other. And if we don't have a functioning, strong healthcare system, then everything else is, at its mercy of crumbling, the way we've had our economic repercussions of this current pandemic. Um, I wanted to just touch a little bit more on the ACA real quick, and then I want to talk a little bit more about what it's been like for you with the pandemic on the ground. I just mentioned the fact that, obviously, as a consequence of this pandemic, this public health crisis, we've had an economic crisis, right, that has ensued. We have millions of Americans who are unemployed, and that's for various reasons. For businesses shutting down, obviously limiting movement around our societies, with our communities shutting down. We have had millions of Americans who have lost their health care coverage because of so many folks who are tied to their employment, in their employer-based health care. And it's really brought to light this other aspect of my healthcare plan, and something that we've heard about a lot is this idea of a public option, right? What does that do? It really, and by a public option, just to explain to everybody, what it is it's allowing Medicare or a Medicare type entity to compete in the marketplace, right? So where you go to the marketplace and you might have United Healthcare and Aetna and all sorts of other ones, you'd also have Medicare. Now, Medicare is highly efficient, highly effective. It's not perfect, but it's highly efficient, highly effective. It's cost effective. It's 1/10 of the overhead. And if you allow that to compete in the marketplace, This actually allows the free market forces to work. This is actually a very fiscally responsible plan. This is not a handout, it's a buy in, and it allows the free market forces to work. It gives us greater choice as consumers, it enhances competition, and it drives down costs. And imagine if you are somebody who has lost their job and lost their employer based insurance, knowing that you have that to fall back on and a very affordable option. But also, Quinn, I think a lot about we have 165 million people, right, that are on private insurance through their employers. And granted, a lot of those folks might be very happy with that. We're not looking to pull the rug out from under them. But think about those people who may want to retire early, folks who want to start a small business, maybe leave their job, start a small business, maybe move closer to family. And so many other reasons, right, that somebody may want to leave their job, but they don't. They stay tethered to that job because of healthcare. And we have to loosen that connection. For the people who are happy with it, great. But there are so many folks who need that freedom. And having this public option would open up so many other pathways for people because we have to have more flexibility in our healthcare coverage system and we have to have more affordability. And I mean, I want to hear your thoughts on it because to me, I think having that public option step in is the next best step to getting us to that goal of quality, affordable healthcare.
Yeah, I totally agree with you, Hiral. I'm a public option person myself. Obviously, there's a lot of conversations going on within the Democratic Party about what is the best pathway to universal health care. Me personally, I tend to agree with you that I think the public option is the best option at the current time. And I think it will allow the private health insurers to begin to actually compete in the marketplace, and hopefully the government will be able to put together a product that is appropriate and reasonable and provides adequate health insurance to people. There's, I think it's important to know that this is all part of the conversation how to get to universal health care, and I think there are various perspectives on how to get there. But I totally agree with you that I think that a public option is probably the best, most likely, honestly, way that will ultimately, and probably what's best for our patients at the current time. People say that they don't love their private insurance companies, and it's true. I think most people don't necessarily feel strongly about some sort of allegiance to their health insurance companies. But I think if they were actually permitted to compete appropriately in the marketplace, that might change. I think people might see that there's certain companies that provide a better product than others, and they would be able to choose what's best for them and keep their doctors and all those things. And you talked briefly about the linkage to employer-based healthcare. I think that's something that cannot be understated. I mean, the opportunity to have a public option where you're not anchored directly to your employer will only increase entrepreneurship in this country. It'll allow people to go out and start their own businesses, try out new things. And, so many people get stuck in dead end jobs that they feel totally obligated to because what else are they supposed to do? They risk potentially giving up their health insurance and they have to protect themselves and their family. And of course, I respect that. I completely understand those decisions. But just imagine how different that would be if you didn't necessarily feel anchored to those businesses and you could go out on your own. So I think it's actually a win-win for everybody to have a public option. For me, it's definitely what I think would be best.
Yeah, and I think it would be best for patients. It would be best for, as you mentioned, insurance companies would have to work harder to create a really optimal product. And again, that's good for everyone. That's the free market at work. And I believe that this is something that we should really be able to get bipartisan support on. But you pointed out the fact that this is about getting to that goal of making sure that every American is covered, and unfortunately, that's where our paths, not your and my path, but my path with my opponent, diverge acutely because when we talk about healthcare, it's about how do we get to that goal of quality, affordable care for every American. When my opponent, Mr. Schweikert, or his ilk talk about healthcare, it's about repeal and replace. But it's never. There's no replace. There's not been. They've had 8+ years to come up with replace, and there is nothing. This is all about repeal. It is all about satisfying their corporate, donors, and about party leaders, and it's really just about tearing down something that they ideologically just don't agree with, which is heartbreaking. Because as we know, this is not just a financial issue. This is an issue of human toll. We know that it's not just about the cost of healthcare; it's about the cost and the toll it takes on human lives, on families all across our country. So I really appreciate your perspective on this. I'd like to talk a little bit about how it's been for you and your fellow frontline workers right now. Obviously, right now we're seeing Arizona come what looks like, after this big surge we had, this deadly surge over the summer, which was devastating. We obviously lost thousands of our fellow Arizonans. And we know that we got to this point where emergency health response guidelines were put in place about possibly needing to ration care, right, where medical resources were truly tapped. And obviously healthcare workers like yourself that are on the front line must have been beyond exhausted. I know you and I have spoken many times during that time, and we talked a lot about the toll it was taking on healthcare workers. I wanted to, just ask you if you could talk a little bit about your experiences on the ground and the impact it's had on your fellow healthcare workers, and certainly, if there's anything you'd like to mention as far as different points of the response from either our federal government or our state government that would have made a difference in your ability to deliver, more optimal care.
Yeah, wow. I think I'd speak for pretty much everyone that I feel like over the past 6 months or so, I've lived at least 6 years. In that time, it's been absolutely exhausting. Truthfully, I think this is about the most difficult time that it's ever been to be a healthcare worker, and especially in July. I mean, if you were practicing medicine in July in Arizona, it did not look like anything you had ever seen before. And let's hope that we never, ever see anything like it again. It was a very dangerous time. Obviously, the crisis standards of care had been implemented. We were in a position where we were bringing in disaster teams to help with medical care. We were having providers act well outside of their scope of practice, doing things that they normally would not do simply to be able to take care of the excessive patient load. We had we had adult patients being housed in pediatric hospitals. And I mean, perhaps most astonishingly, I mean, we had Doctors Without Borders was deployed to the Navajo reservation here within our state. I mean, that is mind-boggling. They've never been deployed in America ever. And to have things in that serious of a crisis and to have taken such a cavalier attitude leading up to that time was so difficult to watch. And myself and many others, we were doing whatever we could to try to convince the state government in particular to reverse some of their decision making as to how they were handling the coronavirus. As you know, Doug Ducey, our governor, he prevented mask mandates from going into effect for a full 50 days. It was no municipality or county was allowed to put a mask mandate in place, and even after that time, unfortunately, he still has not put a mask mandate in place. Although most of the mask mandates that have gone up, including thankfully the one in Maricopa County that went up, covered roughly 85-90% of people in Arizona. And obviously, when you started to see that, and when you started to see a lot of the businesses being closed down temporarily, you saw that we were able to get things under control. But the truth is, we were probably within weeks. I mean, we're talking 1 to 2 weeks of being in a position where we were talking about serious rationing of care. We got that close in this state, and we were scrambling to cover the patient load. And truly, I think it was a scary time to be practicing. What we've seen since then, where there's been a much more careful approach to reopening, it seems that we're now we've managed to really contain the virus to a point where it's started to plateau at a very manageable level. I think I would love to see even more work done, especially in these totally harmless interventions like a state mask mandate. It boggles my mind that we still don't have that. But it's important, at least. I'm glad that the governor has also started to wear a mask on TV and advocate for that, because it's important. Like, people look to their leadership as to how to act, how to comport themselves. And boy, if you ever saw any bigger failure in representative leadership, it couldn't have come more from the president of the United States, who truly failed to wear masks for so long, and even still doesn't wear masks often, and also holds these rallies where no one's wearing a mask and they're all next to each other. People have literally died as a result of these rallies that he has had. People have died because of his political rallies. I mean, I just cannot imagine any greater sense of irresponsibility to be seen from one of our elected officials, that their own personal interests would override the interests of their constituents. It's absolutely, in terms of the federal response in particular. Um, I think that we should have had a lot more, a much more robust federal response. We should have seen the federal government try to help implement mask manufacturing. There's still a huge shortage of N95 masks in our community. I just worked yesterday and I was wearing a mask that I have probably had for literally weeks. And these are masks that prior to COVID, I literally would wear for one patient and toss aside as if it was like a Kleenex or something. And now we have to carefully ration these things. But there's this continuing sense from healthcare workers all across the country, and definitely here in Arizona, that there need to be more resources coming out of the federal government, especially masks, but also the testing. I mean, the testing still is not where it needs to be. We've made huge gains, but we can never go back to July, where me as an emergency physician, I got a test and it took 12 days to come back with a result. 12 days. And that's me. I'm a frontline worker. I'm an emergency physician. That's totally inexcusable. So it all just goes back to this idea that truly we really need, we need real leadership in this crisis. We need more people who believe in science, who care about medicine. And there is a dearth of physicians present in the federal government who are there to provide their opinion about how to manage this pandemic. And the truth is, there's one other female physician right now in the House of Representatives, and there's only 14 physicians out of 435 people, and we need a lot more of a presence, because we can't let this happen again. We will not let this happen again. I just it's totally inexcusable in a country that has as many resources as we have and as many good people working in the healthcare profession to face these challenges the way we have again.
Yeah, well, very well said. And especially when when you consider that we had noticed, right, that this virus was coming to our shores. We knew it was obviously impacting other countries. We we've also now seen so many other countries who got through the pandemic, got through their public health crisis with much less loss of life, with much less suffering, with much more brief economic consequences. So it's none of this was beyond our abilities, like you said, with this country's resources, with our wherewithal, with our intellect, with our financial abilities. There's no reason, except for failed leadership, that we should have ended up where we did. And this leads me to a question that I'd like to just touch briefly on, but it's about this idea that we have to debate the validity of science, of data, of facts. The fact that science has become politicized and become somehow partisan. How many times did we see these like iPhone videos out on social media about people not wearing masks, and then screaming at somebody who was wearing a mask or was telling them to wear a mask because they thought it was some sort of political imposition and some kind of um, partisan demand, rather than the fact that it was based purely in science. When we start debating whether facts are facts and science is to be believed, um, it's terrifying because I think about what it does to the public trust when our leaders are questioning things like that. We know that countries like, New Zealand and South Korea and other ones that, just where there's a general amount of respect for, if the government is saying we should do this, let's listen to the facts and let's try to, follow the example that is set. And there's a feeling that, that they're looking out for the greater good. And if we lose that kind of trust in this country, the way we've lost it in this pandemic, if we lose that further, as you said, I mean, I don't know how we would make it out of another crisis like this. It is mind boggling to think of the number of lives lost and impacted, the number of families that have lost a loved one, the number of businesses that have shut down. We still have kids that aren't in school. We have teachers who want to go back. We have so many people who want to go back to work. We want you and all of the colleagues who are out there working in the front line to feel safe about working and then going home to their families. But a lot of this goes back to us valuing science and data, and just want to hear your take on that, of what you're hearing from people, like even patients. I mean, are there people that you've encountered that are just truly questioning whether this is a real pandemic, if this virus is real, and if that's really the cause of what's causing their illness? I mean, have they questioned the truth of the situation?
Yes, I have certainly seen people who do not believe this is real, which I find very astonishing. And, I guess I can understand how a lot of people are not seeing what I'm seeing. The things that we're seeing in the emergency department and that we've seen over the last several months are totally unprecedented. It's obvious that this virus is real. It's astonishing how much of an anti-science sentiment is out there. I actually had a patient tell me the other day. I walked into the room and he wasn't wearing a mask. And I said, "Sir, would you please put your mask on?" And he said, "Oh, don't worry about it. I don't need to. It's not real." And I said, "That's great. Can you please put your mask on?" And he put his mask on. And then he proceeded to tell me that this whole thing was caused by 5G radio towers. And there's this very bizarre narrative out there about 5G radio towers causing this misperception of the virus or something. I mean, it's not even worth your time. It's not worth considering. But yeah, there is a lot of misinformation out there, and it's terrifying because that misinformation is not coming out of a vacuum. That misinformation is coming in order to align with somebody's political and theoretical economic interests. Although we've seen time and time again, and I don't know how many times we have to go back to this point in the pandemic, but we all should know at this point that you cannot resolve the economic crisis of this pandemic without first resolving the public health crisis. This is seen in pretty much every sector of the economy. And once people begin to start taking this more seriously, as if it is real and scientific, and that this is a serious problem, that the faster we will get this under control. And luckily, I think we've started to turn the tide on that. Truly, I think we've the message is starting to get out there that it is real, but there is this ongoing the population that is heavily anti-science, and one can only find it very disturbing and nothing short of that.
Yeah, and I think your point of it trying to fit somebody else's narrative, political gains, or politically expedient goals, it is terrifying because the consequences are incredibly real. They're very dire, and when I hear people say things like, "Well, we've done our part. The numbers have come down, so now we can kind of go back to real life or normal life." I want to remind people it's like when you take an antihypertensive medication, right, for elevated blood pressure, and then you go to the doctor, and then the doctor, he or she says, "Well, your blood pressure is doing really well." Well, it's doing well because you're taking the medication. Now, we are doing well because more people are wearing masks, more people are following those social distancing guidelines, and people have taken it more seriously, like you said. And there are gains in testing, but if we get complacent on any of that, there is a very real chance of another surge. And we're already seeing evidence of that in other states where numbers are starting to tick up. And I would just, it behooves all of us to remain incredibly vigilant, to not, become complacent and not somehow think that this is truly done or gone. It's just that we have a better grasp of it. We are managing it better, but it's because of these very active steps that we've taken. So I certainly hope that we can continue to get that message out to everybody, not just, and it should never be based in politics or partisanship. Certainly. I want to remind folks that if you put your questions into the text, we still. I wanted to actually open it up now to our Q&A part of this conversation. Quinn, if you're good with that, we can answer a few questions that may have been submitted. So if there's any questions, I think my team's going to put them up. Great question. I don't know if you can see this. How would you
I
address
can't read
rampant
it. Yeah,
price?
sorry.
Okay, no, that's okay. The question is, and I want to hear your take, and I have a few things to say as well, but it's how would you address rampant price gouging of prescription drugs? That's a great question. Whoever submitted that, thank you. Would you like to say anything about that? I'm sure you've seen the consequences of that in the emergency department.
Oh, I've definitely seen the consequences of it. I think the question is a very good question. How do you limit the price gouging? And truthfully, you need more regulation. You need somebody who's willing to actually step up to the pharmaceutical companies and intervene more in what they do. And trust me, I love pharmaceutical companies and the wonderful drugs that they've given me and my colleagues to treat our patients, and they do an amazing job. They've done incredible research. But don't forget, a lot of that research is funded by you, the taxpayer. You're helping out the pharmaceutical companies, and you should expect a certain degree of service, and profiteering, frankly, should be limited to a certain degree, in my opinion, from the pharmaceutical companies. But I don't know. I'd like to hear what do you think, Carol?
Yeah, no, I agree with you. I mean, look, we need one of the things I've been calling for quite a bit is just more transparency in pricing, because I think it's important for us to know, what portion of that cost of that medication is going to manufacturing the medication, is going to packaging it, is going to the research and development that had to be a part of the foundation of developing that drug. You're absolutely right. We have benefited from the development of some amazing pharmaceutical interventions that have literally not just saved lives, but transformed lives, and, made diseases that otherwise would have been debilitating, become fairly manageable chronic illnesses that allow people to have quality of life. So we absolutely appreciate, right, the pharmaceutical industry in that sense, that they are bringing true value to medical care. But if those pieces are not affordable, then the value is lost. And so I think transparency in pricing does a couple of things. Number one, it helps consumers understand what part of that is really going to the cost of the drug, because I think sometimes that we do need to know that, there's a substantial cost to R&D, there's a substantial cost to manufacturing. Okay, I get that. But ultimately, when drugs, for example, go generic and we still don't see, a reasonable price drop come consistently or in a timely manner, or then we've seen too often, right, where drugs are repurposed, and then all of a sudden the generics gone back to the original namesake, and then the price goes back up. What I don't want to see is that there's a large percentage of our the costs that are going to pad the pockets of the pharmaceutical industry, the bonuses, the work more focus on what their shareholders are making at the end of the quarter, rather than the impact it's having on truly advancing medical care. And I think if they would be forced to show full transparency of their pricing, I think it would change the philosophy a lot of those pharmaceutical companies. I also think we need more timely, movement into the generic form of medications, because sometimes those are, somewhat held back for longer periods of time. Again, just making patients pay larger amounts for drugs that they probably could get at a much cheaper level that should have gone into generic form sooner. I think it's also about the fact that Medicaid and the VA can negotiate lower drug prices for for people who are on those programs, but Medicare can't negotiate those lower drug prices. There's no rhyme or reason to this, and that is something that has to be addressed, and that's something that is literally, that obstacle was put in place by legislation, which clearly is because there is a conflict of interest. There are too many people in Congress, in Senate right now, in leadership positions, who are working to benefit the pharmaceutical industry and the corporations more than they're trying to serve their constituents. My opponent is a perfect example of that. He has taken hundreds of thousands of dollars from the pharmaceutical, the hospital industry, the insurance industry, and every single time, it's no surprise that he votes in their favor rather than in favor of the 800,000 Arizonans he's elected to serve. So I think there are several things that need to be done, but I definitely think regulation and more oversight and more transparency of pricing, as well as bringing drugs to generic market sooner. I think some of those are really the steps that we have to take, as well as removing the outsized role of corporate money in politics. Because as long as we have those corporations that are standing in there, giving money to leaders, essentially buying these votes, we're not going to make true progress on a lot of these issues. So, but that's going to be a whole other conversation. So I appreciate that. What other questions do you guys have out there? We'd be happy to answer them. Oh, this is a great one. I look forward to discussing this, Quinn. How can Arizona prevent another COVID spike? Do you want to throw some thoughts out? I'm sure you've got a few.
The number one thing is a statewide mask mandate. It's just absolutely unbelievable to me that we don't have a statewide mask mandate. We're not ready to take the masks off yet, and we might not be ready for several months. That's probably the number one thing we can do. Continuing to add increasing capacity for our ability to get testing, hopefully more rapid testing in the future will also be important. It would be really wonderful if we could initiate a contact tracing apparatus. We are so far behind where we need to be with contact tracing, and the state does not seem to be in a position where they are all that interested in actually building an apparatus that could contain the virus further. So that's what I would do if I was able to make those decisions. I'm certainly not in that position, but I would certainly advocate for those three real basic principles of epidemiology and pandemic containment, which is test, trace, and isolate. Those are the fundamentals.
Yeah, absolutely. I know you and I have talked about that quite often. Test, trace, and isolate. And we are not where we need to be on testing. We are still not testing asymptomatic people. We're not testing people enough, often enough. We don't have results coming back as promptly as we need them. And as you mentioned, we don't have contact tracing infrastructure in place. The efficiency, the time frame in which that has to be conducted, none of those standards are being met. And I think a lot of this is about, again, it comes back to leadership, because I think the sooner we can just say, look, this is something we're going to be dealing with for a while. So how are we going to manage this safely? We don't have to go back to a statewide shutdown if we can do things safely. But we can't just, deny that the virus is there. We have to face it. We have to implement the data-driven guidelines that we know work. like you said, a statewide mask mandate. That would be a huge deal. We know that we have these mask mandates in place because mayors took initiative, because the county took initiatives, but we really need that across the state. And frankly, it'd be great if we had it across the country. Um, but I think just acknowledging that we are facing this pandemic now, we've been facing it for about 8 months. It will be here for a while longer until we have a vaccine. And if we want to try to resume some sense of, movement around our communities and life, and pursue some degree of economic recovery, we're going to have to make these sacrifices. We're going to have to be mindful of keeping gatherings to small numbers, making sure that we are wearing masks, making sure that we are being very clear about testing criteria, and we're being vigilant about that throughout our communities, and we're following the data. It just comes back to the science, right? It comes back to let the public health experts guide us. And I think as long as we do that, I know that we can find our way out of this. And I do believe that it's going to be with us for a while. So the sooner we accept that and we do the things we know that can keep us safe, I think we can actually manage it pretty well. And we've shown that, right, by coming out of this surge this summer, because people were more mindful and took these active precautions. I think I know we're running out of time, but I wanted to just touch really quickly on one thing because everybody is talking about a vaccine, right? Um, Wanted to hear your thoughts on, if or the time frame that you think we may have one, and just your thoughts on how that might be distributed and so forth.
Well, I mean, boy, that is the hot topic right now. What is going to happen with the vaccine? Uh, I know some people in the industry, and I've heard some talk that we're hoping that we're going to start to see potential vaccines become available maybe as early as December, January. But this process should not be rushed. This is not something that we should push forward. And especially if we bring a vaccine to market that is something that doesn't work or causes significant complications, that we are going to really it'll backfire on everybody. Then all of a sudden no one will want to get the vaccine, and rightfully so. I mean, you're not going to want to get something that's unsafe for yourself, and frankly, as an emergency physician, there's a good chance that I'll have access to this vaccine very early, and I'll have to make that decision based upon the best evidence as to whether or not it's safe. But people should understand that it's not like, once the vaccine comes out, say, like I said, best around the turn of the new year, um, it's not like we're all just going to high five and the pandemic's over. It doesn't work that way. We have to distribute it, and it's going to take probably at least 6 months to get out to the general population. And then even beyond that, we still don't know how the length of immunity that these vaccines provide. We're not certain if it's going to be months, years. We just don't know. We're doing the vaccines in a completely novel way this time. But I think the first hurdle is to make sure that it appears to be safe. But unfortunately, there's certain variables, such as letting time run out or run forward in order to assess really whether or not it's safe in the long term. We're just not going to have that luxury this time. And I think a lot of people are just going to dive in. And truthfully, I probably will end up being one of those people, presuming the early evidence appears that it's safe. But I can't state enough just how important it is to understand it's just not going to be over the day after the vaccine comes out. It's gonna take a really long time to develop that vaccine induced herd immunity that we hear a lot of people talking about, and that's probably the only safe way we're going to get to real herd immunity, by the way, is through a vaccine, and not by allowing people to just get the virus. That if you hear people saying that, and I'm sure you've heard people saying that, it is a sham. It is not a real solution. You're talking about millions of people dead if you let them just get the virus. It's not a way to end this. We need to develop vaccine based herd immunity, and it will take a while to get there.
Yeah, absolutely. No, I could not agree with you more. And I think I just want to encourage everyone to understand. Look, vaccines typically take several years, through the research process, the clinical trials, and the safety testing, and so forth. So. Um, I think even thinking we'll have one at the turn of the year, I think I know that there are obviously incredible researchers that are working on this night and day, but I do think that even that is considered fairly soon. That being said, obviously we need to let the health experts, the medical experts, the virologists, the epidemiologists, the people that are doing the research, let them tell us if and when they are ready, and that that the studies show that it is truly safe. But what I would encourage our lawmakers to do in the meantime is exactly what you kind of touched on, Quinn, is if we're going to anticipate this vaccine will be ready sometime next year, let's figure out how we're going to manufacture it. Let's figure out how we're going to package it, how we're going to distribute it. What is the plan of how we're going to administer it? Who will receive it first? What are the populations of folks that we want to make sure get it, in the initial round? Because, like you said, it's not something that all of a sudden is just going to fall out of the sky on everybody's lap. We're going to have a very comprehensive strategy. And unfortunately, that is something that has been missing throughout the handling of this pandemic, that we have not had either at a national level or certainly in our state level, is a comprehensive strategy. And certainly as, this is something I think as physicians, we always anticipate, right? We look down the road, we think about potential complications or problems or pitfalls, side effects, what other interventions could we put in place? How will we prepare for that next step? We need more of that proactive thinking in government. And right now, we have this prime opportunity. A vaccine will be an amazing, you know, huge step in our ability to control this pandemic and get our country back on track. But if we don't have a national comprehensive strategy and plan in place for all those steps, we're going to find ourselves again where we found ourselves back in March or April, with not enough supplies, not a full understanding of who gets it, when they get it, who gets it first, how it'll be distributed, how it'll be produced, and so forth. So I really hope that we're able to get that national comprehensive strategy in place, so that when the vaccine is ready, we can get to work and get everybody immunized, and start working our way back to some sense of normalcy. Well, listen, with that being said, I know we've run a little bit over time. Thank you so very much, Quinn, for joining me this evening. I have really enjoyed our conversation. I really hope that everybody who listened, who watched, was able to glean something from this. I have such tremendous respect for you. Both as a clinician and as somebody who's been advocating for healthcare and healthcare coverage. So thank you for being out there fighting the good fight every single day. And again, thank you for your voice. We need it now more than ever. And please take good care and stay safe and be well. Thank you for joining us.
Thanks so much for having me, Hiral.
Absolutely. And thank you to all of you that joined us this evening. I hope this was as worthwhile for you as we'd hoped. And please take good care, stay healthy, and be well. Wear your mask, wash your hands, and stay safe. Thank you so much. I'll see you soon.